Good afternoon, sir. Myself Dodwadia Balvant from Group 3009, and today's my topic is ischemic heart disease. Before going to the topic, we should know that what is ischemic heart disease. It is a disease caused to a heart where there is insufficient of oxygen supply for the heart, and mainly the coronary artery supplies the heart muscles, so the main blockage will be on the coronary arteries. And if we see the types of the heart diseases in ischemic, they can be coronary artery disease or atherosclerosis, where there is a formation of plaque in the arteries of coronary artery. So and by this topic here, we come to know that ischemic heart disease in India and its laws and its all the uh, problems and its statistics and its all the datas. And first of all, ischemic disease was the main leading disease in the worldwide in the year 2010. The more than 90% of the peoples who were more than age of 70 had ischemic heart disease. And it's mainly in between 1990 to 2010. It was about 90%. And if we see in the second slide, we see the background of this disease. um, in between 1990 and 2010, there was a increase of 29% of ischemic heart disease in all over the world. And in India, about 32.4% of the growth was seen in the peoples. And and in 1990 and 2010 was a aging population, so there was more chances of having ischemic heart disease. And there were total non disabilities to the whole year. And also there was a per capita income decrease of 25.3% in the country of India. And if we see the current situations of India, the ischemic heart disease is the main cause of heart attacks or heart death problems, and it's increased mostly of 80%. Because nowadays we can see that many of the peoples have taking high diet with more cholesterol levels in them, so the percentage always increases and having the more risk for the death by the ischemic heart diseases. And if we see the whole total global burden disease study, so there will be a death to 272 per 1 lakh people in India. That is very much higher than normal average, which is about 235 per 1 lakh population, which is given by the WHO, which is the normal range for the ischemic heart disease in every country according to the 1 lakh populations. And also the disease has transmitted more number of cases in the last 2 decades, and it's rapidly shifted to age delaying chronic diseases. And if we see the epidemiological transitions in last 2 decades, it has a short time frame, and the number of cases has increased, and the normal value has gone up to the almost 80 to 90%. And if we see the statistics about the ischemic heart disease, it is hard to count, but we can say around about 1.33 billions of people are served by 1.8 billion registered medical graduations. So the ratio is about 1.34 for doctors, about to 1000 Indian citizenship. And also due to the lack of less doctors availability and not the proper guidance for the patients, the ischemic heart disease has also taken its foots on the of for our country. And about more than 1.79 millions will be advised, or they are affected by the ischemic heart diseases. And if we see, there also in India there is birth rate is more and death rate is less, so there is always chance of increasing the percentage for the ischemic heart diseases. And if we see the life expectancy also, it is about 75 to 68 years, and by the years or by the decades it passes, it has the life expectancy has decreased due to the this ischemic heart disease and other such types of disease, because the main problem for this all the diseases are that we are not following the proper diet, and we are not taking proper food and not taking according to the calories, and we are taking more from the cholesterol foods like junk foods. We visit the cafes, we visit the pizzas, and the burgers and etc, which causes more cholesterol levels in our body. So these are the main problems causes India. And the public health care is and and if we see the outpatient and inpatient total percentages of this ischemic heart disease, in India sector there is 18% of total outpatient care and 44% of total inpatient care. So there are less number of outpatients and more number of inpatient care. And if you see health facilities, India is a country where the health is mostly provided to all, and they have a law so they can get everyone health facilities. And if we compare India with the other countries, India is the cheapest healthcare system in all over the world. And there are many areas there where they have built like rural and urban areas. They are hospitals, and they have centers like many parts. And India has reached to the root level of the villages for the treatment of India and their peoples. And mainly they concentrate on villages people, so that they don't get affected, or they don't have to travel to the far. And if you see the national health profile, this is the health profile, where you can see it was issued in 2019. You can see all the logos, like polios, national health policy, Ayushman Bharat national health protection mission. This one is national urban health mission, and this one is Janani Shishu Subkasha Karyakram 2011, and prevention and control of the cancer, diabetes, and cardiovascular disease and stroke. And this one. And if we see the laws about this health cares in India, there is according to the article 21 of constitution of our Republic of India, there is a rule from which states that state policy and therefore induces protection for the health. Right to health is integral to the all people of the country, or by the state, or by any by division where there exist. And also article 21 says that there is no violation will be on the health relations, and so there will be all are treated equally, and there will be all treatment should be given all to the according to the and their diseases, and no violations will occur on these treatments. And if we don't follow these rules, or we break such rules, and if we don't treat the patients, or if we just pretend to like we have treated, so there will be a jail for the doctors or the practitioners whose practices such illegal facilities. And in response to the government, the national level of government of India has undertook some various health programs, such as we saw in the previous slides, like Ayushman Bharat, National Urban Health Missions, Janani Shishu Suksham, National Health Care Policy, and WHO remove also for the polio. So these laws also can be practiced, and these are all the calls. And there was also a 11th 5-year plan, which was called as National Program for Prevention and Control of Cardiovascular Disease and Stroke, which was for 5-year plan, which was from between 2007 to 2012. And if we see and if we see the recently Public Healthcare Foundation of India, there is collaboration between all the states and the main central head, where they participate with each other, and they provide their which what kind of health facilities required, and what all the instruments and what all the necessary equipments are required for the such kind of diseases. And by seeing all, and last but not the least, I will conclude my the topic of ischemic heart disease. As the ischemic heart disease, we already discussed that it is a less amount of oxygen to the heart, where they are died, or they can be a stroke like conditions. And with the country India, the population has more, and the less doctors in India, so they have many problems, and we have many healthcare facilities, because due to the increase in populations. And so the all the people who have low socioeconomic status, they are less to the they are less and not vulnerable to the ischemic heart disease. And the primary prevention should taken on talking to the patients, or talking to the old peoples, that they should not follow the fatty diets or the junk foods, or they should eat the foods like we Indians call the desi food, which consist of rotis, chawals, means rotis, and rice, which with low cholesterol and only carbohydrates, and no other such facilities. And also we Indians, we eat more green vegetables, for the improvement of our health problems. So by this I conclude my topic, ischemic heart disease. Thank you, and thank you so much.